Today I am performing aseptic technique with a drape and also donning and taking off gloves. I will collect my equipment, sanitize my hands, come into the patient's room, identify them with two forms of identification, tell them what I will be doing, and then proceed. First I will take my drape, make sure the package is not wet, make sure that the expiration date is fine, open it up away from me, drop it on. Open it up, only touching the blue. Pinching the corners. And slightly unfolding it. I will also touch the corners in order to flatten it out. Next, I will start dropping my other instruments. Doesn't count. Look at the package, make sure that it's not wet, make sure that the expiration date is fine. Open it up away from the body and drop it onto the field. Next I will take my gauze, cover sponges, make sure that the package is fine. Open it up away from the body, drop it onto the field. And for my last piece of sterile, expiration date is fine, package looks fine. Open it up away from the body and drop it down. That is aseptic technique. Stop it. There we go. And then we'll go into gloves. And part two will be donning and taking off sterile gloves. I will grab my gloves, make sure that the package is not open, and make sure that the expiration date is okay. Peel away from the body, drop it onto my field. Touching only the outside portion, flip it open, make sure that the cuffs are to me. Open up the inside. Okay. Stop, you're gonna have to erase that. So the next technique will be opening, donning, and taking off sterile gloves. I'll grab my gloves, sanitize my hands. Check the package, make sure expiration date is fine. Make sure it's not wet or contaminated. Open it up away from the body. Open up the outside portion, flip the bottom, make sure that the cuffs are to me, and then peel to show the gloves. By touching only the flip portion with just my finger and thumb, I'll insert my hand. And then using 4 fingers, keep my thumb away. I'll slide my other hand inside the glove. That is putting on sterile gloves. Now to take them off, I will pinch the palm of the one glove, roll it up in my hand, use 2 fingers, slide it inside the cuff, and roll it back. And that is kind of like donning and taking off a pair of sterile gloves if they don't rip. Then I will wash my hands.